Is it possible to thrive in menopause? Find out on this episode of Inspire Iredell.
Welcome to Inspire Iredell. I'm Megan.
I'm Anna.
Today we are delighted to have with us Dr. Rachel DiSanto. Welcome, Dr. DiSanto.
Thank you.
So DiSanto is wildly popular among our physician network here. So she's a board-certified family medicine physician at Statesville Family Practice and also serves as the medical director for the Iredell Physician Network, which is part of Iredell Health System. She has over 18 years of experience in medicine and enjoys reading, traveling, writing, public speaking, teaching, and serving medical missions. So lots and lots of things. I'm not sure when you have time to do all of those things,
Yes.
but
Not all at once.
that's fantastic. So what do you like to read?
Yeah.
I like to read fantasy.
Yeah, same.
Yeah.
Kind of a mix of all things.
Classic English lit.
Oh, really?
Really?
Wow.
Like your Pride and Prejudice,
My favorite
sort of
book.
things.
Yeah,
Yes.
absolutely. Lord of the Rings, Pride and Prejudice.
Okay.
Just British authors.
Okay. Fun.
Where have you served medical missions?
Africa, several places, Haiti, El Salvador, Nicaragua.
Whoa.
Wow.
That's pretty amazing.
That is really
Did
cool.
work for 10 years with the anti-human trafficking movement and some other things like that. Yeah.
Wow.
We just did our last podcast.
Yeah, I know you did. I saw her.
Yes.
I know. She's wonderful work. That organization does amazing work. So.
Absolutely.
Yeah.
Yeah, it scared the heck out of me.
Yeah, it is. It's one of those topics that's really tough because once you start to learn about it, you can't unknow it. So I always warn people you have to approach it with caution and just make sure that you're being mindful of what you choose to learn about it and engage with because it's a hard one to back away from.
Absolutely. Yeah. Well, speaking of approaching with caution, so today we're talking about warning. We're talking about menopause.
Yes, very much caution.
And I'm just going to throw this out there. This is a good thing for even the men to listen to because the more you know,
Yeah.
right? Like empower yourselves.
Yes, and the more myths that you are dissuaded of, so you can help the ladies in your life who are going through it.
Yes. So, what is menopause? It's so broad.
It's very broad, and it's still sort of a mystery in a lot of ways. It is a cultural event, certainly. If you look around the world, menopause occurs and is approached and perceived in different ways. But obviously at its foundation, it's a biological event that happens in women at a certain stage of life, usually middle age or just beyond. And there are very clear biologic roots within that. And that's sort of what begins the process. But certainly there's a lot more to menopause than just biologically what's happening. So,
Okay, so let's define middle age. Really, I feel like it's so different. You hear about women hitting menopause or starting. I don't know what the right terminology would be.
sometimes it feels like hitting.
Yeah. So, is there a family history component? Like if your mom had started menopause at a certain time, then maybe you will as well?
Yeah, absolutely. So it's not a hard and fast rule, but commonly women will somewhat follow their mom's patterns in terms of timing, but not always. There are certainly differences, particularly among women who may have more specific and unique gynecology issues, whether they have PCOS or some other conditions, diabetes, other things like that. But oftentimes it will follow a pattern in a family history.
Okay.
And menopause really isn't an event. It is a phase. And, when I explain this to my patients, I think it makes a lot more sense when I back them up to puberty. Women have multiple hormonal phases throughout their lives where their hormones are shifting. It's leading to biological, psychosocial changes in their lives. And we can all remember puberty. So it's a very similar process in that it's not an event that happens, although everybody thinks of puberty as when a girl starts her period or, when a boy has his voice deepen or whatever. But that is a prolonged phase of hormonal change, rapid growth and development in both boys and girls. Menopause for women is a similar process of change over time. And actually men also in middle age and beyond go through hormonal shifts and biologic changes over time.
That.
We just don't talk about it, and it doesn't have a fancy name other than the menopause.
The menopause?
That one hasn't really caught on. So
We're going to start a new trend.
yeah.
Menopause. We need a whole new podcast for that.
On menopause. Yeah.
Oh my gosh. Okay, so you talked a little bit about, what it is, and it's changed. It's a phase. Has it, from a historical perspective, people are living longer now. So has it changed throughout history?
Absolutely, and that's actually one of the interesting things as I've done some research for the education I've done on menopause. obviously pre-Middle Ages, humans didn't on average live long enough for many women to get into menopause. So there's really not a lot of ancient and pre-modern literature about it.
Okay.
So there are brief mentions of it going as far back as Hippocrates and Socrates, but it really wasn't a major topic because it just wasn't observed, because women really didn't live long enough. A lot of women died in childbirth.
Or you didn't talk about it.
Or you didn't talk about it.
Yeah.
Women were certainly property. They weren't even full-fledged citizens or adults in those contexts. So it certainly wouldn't have been something that was really looked at or discussed. And then throughout history, you start to see it creep in. In the Middle Ages, they called it the witching time, because they would see women have these, hormonal and psychological changes that would make people think that they were losing their minds, that they were crazy. The word hysteria actually comes from the Latin for the word for uterus. So hysteria actually means wandering uterus.
Okay.
So if you look at the historical context of menopause, it really just unfortunately fits into the narrative over centuries and millennia that women are less than, women are not, as rational as men. They don't have all the same faculties and skills as men. And menopause in those times was just considered to be another example of why that is.
Interesting.
Many women, well, not many, but women throughout history, really even up until the early 20th century, would be forced to undergo hysterectomies. They would be locked up in insane asylums, things like that, just because they would have mood disorders associated with their menopause that was not otherwise understood. So very, very sad.
Glad that we live when we do. My
Yes.
goodness.
But really, when you look even at our modern times, the understanding of menopause, in the talk that I gave a few months ago, I showed that clip from that 70s show, and the mom, Kitty, was always in menopause throughout that show, and she was always flipping out and losing it. That's like popular culture's conception of menopause,
right,
is
you're
a
right.
woman just losing her mind and freaking out and not being rational, right? So the concept is still very much ingrained in our culture until
Yeah.
really the last 10 or 15 years, where it's been discussed more in a way that this is a biological event, and it may certainly be associated with psychological changes that can be addressed and can be helped. And culturally, you see that in other cultures. I was just discussing this with a colleague yesterday. In the Far East, particularly in Japan, menopause is celebrated because age is venerated in more traditional cultures.
Moving to Japan. Just kidding.
So, and the interesting thing about that is that Japanese women experience physically menopause a much different way. They don't typically get hot flashes. They don't typically have a lot of the psychological problems that Western culture
That's interesting.
experiences. And anthropologists have studied this, and they don't know, is there something biologically different about, that culture, that lifestyle? Obviously, they eat a lot of soy. That may or may not help with the hot flashes. But because culturally age is venerated, menopause is more celebrated in that culture, women don't tend to experience the psychological and mood disorder effects that a lot of women in Western culture do. So,
Okay, I reiterate. I'm going to move to Japan.
yeah.
Just kidding.
What's going on there? I just think it's fascinating. We don't have answers.
Interesting.
Yeah.
Retirement plan.
Yep.
Wow.
So we're talking about menopause. It happens to mostly every woman in some form or fashion. Why does it happen?
Yeah, and there's two ways to answer that question.
Okay.
The first is the biological answer, right? So the biological answer is that our follicles, our eggs in our ovaries are depleting. So women are born with a finite number of eggs. We don't produce more. In fact, we have all the eggs we're ever going to have in utero when we are in the womb of our mothers. And so when we're born, we start losing them. And the whole process of women's reproductive life involves those follicles. And towards middle age, again, defining that as 40s, early 50s in modern culture, it involves the depletion of those follicles. They go through a rapid depletion oftentimes where your remaining follicles get used up and just leave the ovary, and then that triggers this hormonal process whereby your estrogen and progesterone levels drop precipitously, a few other hormones increase precipitously, and this triggers all of these symptoms and events that we know of as menopause. So that's the biology of why, but if you back it up, some of the more interesting questions to me are, why does that happen at
Right,
all?
right.
What is the purpose of that? And that's a much more, esoteric question, but it's also a very interesting one. If you look from a human development, a human culture perspective, there are some theories in anthropology about it being that those women aren't trying to procreate anymore, and so they don't have that specific need or drive or desire, and so they can then shift to sort of the wise women of a village or of a community and help rear the younger generations, mentor the current adult generation. There's a lot of theories as to why it either evolutionarily or otherwise has happened. But either way, again, when you look at modern cultures where age is venerated and celebrated, and you have multi-generation families living under one roof, it really makes a lot more sense in those contexts as to why that part of the aging process exists. In our modern fractured culture, it really just seems like a nuisance because we don't celebrate it either in popular culture or in our, unfortunately, increasingly our family structures. So.
Wow. So, okay, making sure I understand this right. So menopause is usually triggered when a woman's eggs are all gone?
Yeah, when
basically?
they're depleting rapidly, yeah.
Interesting.
I mean, you may always have a few left here and there. That does happen. A woman may have been menopausal for 15 years, and then all of a sudden a little guy slips out, triggers a period, and they have this period out of nowhere. But by and large, yes, your follicles are rapidly depleting.
Okay.
And once they get below a certain threshold, that seems to trigger this event with the rise of FSH and LH and the fall of estrogen and progesterone levels.
Okay, so that takes us to our next question about symptoms. So how do you know when it's happening? I mean, other than the obvious of like, oh wait, like I've had this period, regularly for however many years of my life, and now it's not happening. Like, what are the signs and symptoms so a person would even know? Yeah, I mean, the really classic ones, of course, are hot flashes, mood changes, fatigue, brain fog, hair loss, weight gain, sleep difficulties. Really, a lot of the sounds like things that are tied to a lot of other things.
A lot of other things. Again, in modern culture, it's also harder to parse that out, right? Especially for many of us who are mothers and or working or both. There's a lot of things that can really play into that. A lot of women in my practice that I observe will really start to complain about the cognitive symptoms first. Okay. So you become a little more forgetful. That word finding thing is difficult. You might have a little more brain fog where it's just harder to focus and concentrate. And mind you, men this age talk about these symptoms as well. So again, this is not unique to women. It's just that women then also have that very, obvious sign, at least to them, when their period starts to change or to stop. And then, of course, the hot flashes. And it's a cruel joke of biology that women get hotter as they age and men get colder because their testosterone goes down. So they tend to be cold all the time.
Oh, interesting.
It's one of those odd things.
So let's talk about hot flashes. Because I think that sometimes people define a hot flash. I think there's some misconceptions or thoughts out there. People are like, is this a hot flash? Is this not a hot flash? Am I just having a moment where I'm getting hot?
Warmer. Yeah, exactly. And there's also like the night sweats, which are very, very common. And then there are distinct from that the hot flashes. They both have their roots in a similar process. What is happening in a hot flash for a woman during that menopausal phase is that the thermoregulatory center of the brain, so the part of the brain that regulates your temperature, gets goofed up and it thinks that a woman is really hot. Oh. Which is kind of odd because why does it make you hot if it already thinks you're hot, right? Yeah. So the brain, that center in your brain thinks that you're hot. So what it does is it sends out all these signals to the rest of your body to deal with the heat. And the way your body gets rid of excess heat is by dilating blood vessels, primarily in your skin, and sending much more blood flow out to the skin so that that heat can be dissipated through your skin out into the air. So when a woman's brain tells her she's hot when she's not, all those blood vessels dilate. That's why you'll see women flush from the head down. And then when it ends, it goes back up. You'll hear women talk about, my hair is hot. It feels like their follicles are on fire because the body is telling all those blood vessels in the scalp and the skin to dilate. It pumps the heart harder and faster. That's why some women get dizzy or they'll feel their heart pounding. And it's sending more blood flow out to the periphery to dissipate that heat into the environment. So even though you're feeling hot and you're sweating more, it's your body's way of saying, get rid of the heat. So the hot flash ends when the temperature has come down and it tells the thermostat in the brain to shut off.
I'm hot all the time anyways, so I'm not looking forward to
Yeah.
And what I will say is I have had a number of women, it's not every woman, I have a lot of women in my practice that say, I never had a hot flash. It's not universal at all.
Okay.
Women who've had hysterectomies, some of them don't even know when they went through menopause because they literally never had significant changes.
I had a hysterectomy 5 years ago now. 5 years ago, 6, I can't remember. But, and so I guess almost 6 years ago. So I was thinking about that. I was like, I have no idea, when it would happen.
Those women, a lot of women will come in and ask about, can I do the hormone tests? And I'll say, well, we can. If you're still having a period or you're having classic menopause symptoms, I'll say, we can, but we already know the answer. You're either in the process or you're not at all, especially if you're having a regular period. But for women, especially who've had hysterectomies and really don't have classic symptoms, it's a very useful set of tests to do to help determine where they're at in that cycle. And the problem is because a woman's natural hormone life involves fluctuating levels. If you spot check a woman's hormone levels at any point during a regular menstrual cycle or in the perimenopause time frame, you never know what you're going to get. You could be catching her in a certain down cycle in her regular menstrual cycle that can look like menopause, but it's not. So it can be a little dicey to sort that out, but it really, you have to couple that blood work with a woman's symptoms and what her period's doing if she still has a period. And that's sort of how you decide.
Okay. And I guess it's important to note, I had my hysterectomy, but I kept my ovaries.
Yeah, so
thus I still had those, follicles and
go
things.
through natural menopause.
Whereas I know some people go into surgical menopause, right? When if they have a full, complete hysterectomy where ovaries are removed.
Correct.
That makes sense because they don't have eggs to
Correct.
get rid of anymore.
They had instant follicle depletion,
Yes.
and that is a miserable process for many women. Not all, but that is a lot of where hormone replacement came from for those women, and especially in younger women. That's very important for them to go on hormones because that rapid change, not only is it horrible for their quality of life and physical symptoms, but it's important for their bone health and other things that they get replacement.
It's like shocking the body.
It's a huge shock, absolutely. Yeah.
So you said, can you define perimenopause?
Yes, perimenopause is another one of those fun nebulous terms. That's just the 2 or 3 years around the time that menopause is beginning to start. So again, where it's a process, not an event, and it's very hard to define when that process starts. We kind of use the term perimenopause very loosely to say, hey, I'm getting there. I'm starting into that that phase. Menopause itself, on average, is about an 8 to 10 year process. Now, some women, it's a year or two. Some women, it's 15 years. I have women occasionally in their 70s and 80s still hot flashing, but that's
Japan?
Japan.
We're coming. We're going to work remotely.
From Japan. It's very, very rare for that, but that, again, highlights that it's a very individualized process. Perimenopause is often noted by women to be a physical sign is when their period becomes more erratic. So their period hasn't stopped yet. They're not fully menopausal. And even though we say menopause isn't just an event, the event that we sort of define it as a year of no bleeding. That's when we say, okay, you are menopausal. You may not be done with that change process, but that's sort of the outward marker we use to say that's menopause. But certainly you can be menopausal before that event happens. And perimenopause is just when women start to notice maybe they skip a month or a couple of months, or a lot of times in that follicular depletion process we talked about, at the end, the ovaries will kind of erratically spit out a lot of follicles, at a much more irregular or even rapid fire rate. So a woman may have a period every 2 or 3 weeks for a while, which is the opposite of what you think would happen in menopause. But that is, again, that, sort of an outward perimenopausal sign.
So what would happen, let's say in Megan's case, whenever you don't have a uterus? Where do they go?
Well, they just sort of end up out in the ether, and I know that sounds really weird.
Like, what?
What's that? But if you look at female anatomy,
Empty cavity.
yeah, it's true. They end up in your pelvis, but mind you, they're microscopic, or nearly microscopic. So when you look at the anatomy of a woman, actually, the ovaries, they're not just floating, they're attached by connective tissue, but they're actually not attached to the fallopian tube. There is a space there, and the end of the fallopian tube kind of looks like a little bit of a vacuum, and the eggs...
It looks like kind of like a flower.
It's like a flower, blossom, and it kind of just, it doesn't scoop up the egg just falls into it. But for women whose tubes and fallopian tubes and uterus have been removed, that egg just sort of pops off the surface of the ovary and it will be resorbed. I mean, it's minuscule, so it sounds really weird and ethereal, but it just kind of goes away. So
Imagine them as little astronauts outside of Earth.
yeah, floating in orbit. That's what they're doing.
Oh my gosh.
All right.
And there you have my health history.
Yeah, there we go. There we go. Okay, so we've talked a lot about the symptoms and how horrible it can be, or you might not be knowing what's going on in your body. What can you do about it?
Yeah, and that's the thing where I think we have a lot of positive things to talk about. And first and foremost, I had this conversation with a patient yesterday. You know, we don't have to approach menopause the way popular culture tells us to, or the way, you know, historically it's been approached. It doesn't have to be a bad thing. It's a lot about what we make of it. And we can all complain about how aging for women in particular in our culture is maligned and not a popular thing. The only one who can change that is us, right? And that's easier said than done. I do not like the wrinkles and the changes that are happening in my life. But nevertheless, it is a lot of how we approach it.
I'm like, she has no wrinkles. She has no wrinkles on her face.
But in terms of how to approach it, you know, certainly medically, there's a number of things we can do naturally and sort of lifestyle-wise. There's a number of things that can be done. The really basic stuff is eat healthy, live healthy, move, exercise. All those things that we all say and all of us struggle to do are the things that still help, because thermoregulation, metabolic regulation, all of those things are things that we need to be focusing on for good health anyway, but that clearly in research make a difference for menopause symptoms as well. So that's certainly first and foremost. Sadly, things like alcohol and caffeine also can make hot flashes. In particular, caffeine can make hot flashes worse. So that's a tough balance. I had that conversation with a patient yesterday. I said, don't give up your caffeine. I was talking to her about all of these things. We talked about, Japanese women and, just the cultural differences. She said, I do all the healthy things, but I love my coffee. I'm like, don't give up your coffee. We were talking about the blue zones and how some of them, some of those cultural groups that really thrive and do well and have longevity as a part of their communities, more so than the average. Some of them don't include alcohol or caffeine. Some of them do. So it's not a hard and fast rule, but by and large, when you're talking about a woman who's really struggling with hot flashes and that's her main symptom, certainly for her, limiting caffeine and alcohol is going to be important.
Okay.
Good idea to have a primary care provider.
Yes.
So you can have somebody like yourself to talk to these, talk these things through with, because, how would you know otherwise?
It's very individual. And, that's where I can hear if a woman's drinking a pot of coffee a day and a bunch of sweet tea and a Monster, I'm going to say, okay, we really got to scale that back for lots of reasons, right? But otherwise, it may not be the deciding factor for a woman, particularly one who's not having a significant burden of hot flashes. The real one that I spend a lot of time talking about are those cognitive changes or the mood changes. So that one is where pharmacologically we have the most to offer. There certainly are plenty of good medicines. There's the whole big controversy over hormone replacement therapy. I like to say I grew up in medicine in the area where we were taught, do not do it. It's not safe. The Women's Health Initiative was originally published, I think, in 2002. And that was right when I was in medical school and residency. And they said, don't do it. It causes heart attacks and strokes and blood clots and cancer. So just blanketly, no woman should ever be on it if at all possible. Before that, we were using high-dose hormone therapy regularly for women's menopause symptoms with good effect for those symptoms. But over the last 20 some odd years, reevaluation of that data, lowering of hormone doses, improvement in pharmacology have led us to realize that there are plenty of younger women who are early in their menopause journey that probably can very safely take hormone therapy, at least for a time. And it's a very valid therapy for many women. There are some that can't. I have a blood clotting disorder, not an option for me. But again, that's where you have to have those conversations with your primary doctor,
right,
or your gynecologist. And I will say, if I may, an aside here, this is a major concern I see. You see all of these sort of for-profit, mostly online companies popping up, advertising a number of types of therapies, whether it's weight loss or ADD therapy or menopause therapy or men's issues therapy. I'm not saying that they're all dangerous, but you really need to make sure, if you're seeking that out online, that those people are going through a full discussion of the risks and benefits of therapies that are individualized to you. Because my experience with patients who come in who have explored those options, they're not doing follow-up lab testing, they're not doing any safety monitoring for blood pressure, things like that. It just really concerns me. And there's my plug for in-person primary care.
Yeah, no, it's a very good point. It's a very valid point. There's a lot to be said for being able to have a conversation with somebody that you trust. And I tell people all the time, if you have a doctor who you don't feel like you can talk to, you need a new doctor.
Yeah, absolutely.
You should have a provider who you feel like listens to you and can help you work through whatever, whether it's just something more chronic or it's something more, hey, you have the flu or whatever it might be.
It's not a one size fits all, and certainly the menopause process isn't either. There's many, many things we can talk about too for treatment, but really it's a combination. Lifestyle, certainly pharmacology for people who need medication help. There are lots of supplements. There's a whole industry of that. And I will just say briefly there to patients, this is what I say, don't spend a lot of money and let me know what you're taking so I can make sure it's safe. Whether it works is another story. We don't have a lot of data. Again, there's some evidence about soy, but that doesn't really bear out in all of the studies about Asian cultures that eat a lot of soy, that's the sole reason. And if you look at a lot of the over-the-counter supplements, some women will note benefit and others just don't at all. So we say your mileage may vary. And if you're really taking a ton of supplements and not having great benefit, but you're that symptomatic, maybe it's time to talk to your doctor about medical treatment.
Else.
Yeah.
Okay.
Are you telling me that my iced soy chai tea latte is okay?
It's probably
it has caffeine, so it depends on if you have hot flashes.
the caffeine and the sugar may offset each other. Yeah, that's another thing that certainly if you look at cultures where they seem to have fewer hot flashes, it's also one of the big differences is ultra-processed foods. So that's ultra-processed foods is like the new boogeyman of American diet, but with good reason. But it's not like the cause of any of these symptoms, but it certainly doesn't help.
Right.
So, question, and this is maybe more of a gynecological question, but a lot of women who hit menopause I think they stop going to see a GYN or having like their, annual women's exam. I think it's sometimes even health insurance won't cover it as frequently. So what is kind of the protocol for that?
I always encourage women, have a primary doctor, whether that's your gynecologist alone or your gynecologist and a family doctor or internist. In family medicine in particular, we do women's health. So a lot of times those women, when they're done having babies and they don't necessarily need to see gyne every year, they'll just transition to me and I'll take care of their pelvic exams. I do that throughout life stages for women anyway, so I'm happy to do it. Everyone in family medicine is. But it's fine and good to see your gynecologist, regularly as well, because they definitely have a lot of expertise in counseling and treating menopausal symptoms. Also, of course, a lot of the abnormal parts of menopause or postmenopausal bleeding, all of those things. So a woman doesn't necessarily need to keep a relationship with a gynecologist forever, but there are plenty of women who choose to because their gynecologist really is like their primary care. And for many years for women, that is great and totally adequate. Gynecologists are also real good though if they start to recognize that a woman is having some more regular, non-GYN medical issues as she ages, high blood pressure, blood sugar, things, high cholesterol, then they will urge them, go see a primary care doctor, for those types of things. So it really depends on your specific situation. If your PCP is a family doc, you really can do one-stop shop. A lot of internists will do some women's health, but some don't. So it's just a conversation they need to have with their PCP.
What about Pap smears?
Yeah, so Pap smears, right now, the guidance is really clear that for women over 30 who are healthy and haven't had abnormal Paps, every 5 years is all you need.
Wow,
and at age 65, we stop. You don't need to have Paps after that as long as they've been normal. Now, that is still an individual conversation, and I have had gynecologists tell me they still think that we should Pap every year, every third year. I've had patients who prefer that. I always tell my patients, listen to your body. If you're concerned, particularly if you're having symptoms or odd bleeding or just anything unusual, of course you need
family
an exam.
history.
Family history. You need an exam. If you've had abnormal Paps, things like that, then you should be going regularly. But for normal, healthy women, by and large, every 5 years is sufficient because we know that cervical cancer is caused by HPV. And every time a woman gets a Pap nowadays in America, at least, she's getting an HPV test over the age of 30. And so if you have had negative HPV tests for 20 years and you're with the same sexual partner, you're very unlikely to contract it and then, have the 10 and 20 plus years that it usually takes to develop cervical cancer. So that's the rationale for that guideline.
Okay.
But it is still an individual decision and conversation, and as such, insurance will cover it. So if a woman chooses or needs to have a yearly PAP even after the age of 30, totally appropriate, insurance will pay for it.
Okay. Interesting.
That's really good to know.
Yeah.
We are out of time, but man, this
Oh my gosh.
happened so fast, right? Thank you, Dr. DiSanto.
Yeah,
This
you're
is
so
very
welcome.
informative and lots to think about.
Yeah.
Lots to think about. I think, and we might have talked about this, I think, when with the Statesville Leading Ladies with the Chamber, when you did a talk on there. Let's just talk real quick about supporting people through menopause, the support system. So like we joked in the beginning about men listen up sort of thing, but how important is that?
Yeah, I think it's important for a number of reasons. First of all, very serious mental health issues do arise in menopause, like they do arise in pregnancy or postpartum period. Obviously, men also have. I mean, mental health is just, obviously a whole other topic, but it's really important to recognize it, to not stigmatize it or make fun of it. I'm not saying we can't laugh. As women, we all joke about, oh, menopause brain or whatever. I'm not saying we can't make light of it, but I think for caregivers and loved ones and support people, it's just important to have real conversations like you would at any stage of life with someone who appears to be having some mental health struggles, because the medicine for that and or therapy both are wildly effective, can really make a huge difference in that woman's quality of life, which, ask people's, family members and loved ones after they get help. It obviously helps everyone in the family. So I think that's a huge part of it, is don't just dismiss it and dismiss a woman as, oh, she's menopausal. That doesn't work. If someone needs help, they need help, and help them get that so that they can return to their level of health that helps them be productive and engaged and have healthy relationships. So it should go without saying, but it doesn't. But the other thing to remember is that this is a biological process that she has no control over. She has absolutely, she doesn't want to be going through this. None of us want to be going through those changes, but it's a part of life. And the other thing that I really harp on, particularly with men and dads, my own husband, I've had to sort of coach on this because we have 2 daughters, that those changes throughout a woman's life cycle are normal. This is not a disease process. It leads to some symptoms the way that pregnancy and giving birth lead to certain symptoms, right? It hurts to give birth, but that's not a disease. It's a normal process in our life cycle. And if it doesn't happen, guess what? Humans don't happen. So I just think the normalization of it in that way, and let's not make it a disease. Just because as a physician, I can give you a medication to help your symptoms, it doesn't mean I'm treating a disease. I'm treating symptoms. If I have a headache, the headache is the disease, or not a disease, it's a headache, it's a symptom. Migraines might be the disease, but the Tylenol helps the headache. So think of it not as a disease process, but just as another transition stage in life that needs to be supported. Would we make fun of I guess we probably do sometimes, our teenage daughters when they're going through puberty? We shouldn't. We should support them and encourage them and affirm that they're healthy and normal, and that it's a transition stage, just like it is for young men going through puberty. So I think if we could approach women that way in general, and if women could give themselves the grace to approach it that way, it would
That's
go.
probably the hardest part right there.
It would go a long way. So,
Thank you so much.
oh, you're
Yes,
welcome.
thank you.
Yeah. If you need a primary care provider, we have several that are accepting new patients within the Physician Network here at Iredell. And if you liked this content, please like, share, and subscribe. Thanks, guys. We'll see you next time.
Bye.
The content here is for informational and educational purposes only, not for medical advice. Consult your qualified healthcare professional for specific health concerns and questions.